The healthcare outcomes compared to China and Canada. We must improve our health statistics and the overall health of our population. Healthcare spending. The US and China spends more on healthcare than Canada, but has the lowest expectation of life of the three. In 2018, the Centers for Medicare and Medicaid Services reported the US healthcare spending was about $3.6 trillion. Healthcare expenditures. That same year, the Canadian Institute for Health Information reported that Canada spent $264 billion on healthcare, while China spent $5.9 trillion in 2018. And that included out-of-pocket spending, government spending, and collective spending. Life expectancy among systems. China has achieved a significant improvement in the healthcare system and healthcare outcomes along with its population lifespan of 76.9 years. The infrastructures of medical insurance are also different between countryside and city-side areas, as the city has a more diverse option of health insurance compared to its countryside residents whom are offered basic insurance, if any at all, triggering inequality with its citizens as they can't obtain effective insurance. The measures of population in these countries as far as health, such as life duration, may not depend entirely on what transpires within the healthcare system, but to its people. The United States lack in this area because 47 million of its people don't have any form of insurance, as these people are unlikely to see a doctor or receive routine care that might detect early stages of an illness or receive the preventative care to avoid any illness. The high prevalence of disease in the U.S. adds considerably to the healthcare spending. Thus, the government will always get blamed for the poor lifespan ranking of its country. Canada's approach for improving the lifespan of its citizens by having an effective health system, public health planning for its population, makes for a stronger economy while monitoring healthcare spending trends to know where to invest their healthcare dollars. Canada's investments in healthcare for improving social conditions as well as public health prevention and health promotion measures taken across the country has helped to reduce both chronic disease and acute illnesses. We demand quality health care. Population increase, a healthy population, and living on borrowed time. Healthcare outcomes will also increase critical to reducing unnecessary disabilities. A healthy well-being means better health because healthy population lives longer. Chronic disease or illnesses, smoking, living unhealthy, it gives a sense of living on borrowed time. The mortality rates, the chart is just showing that heart disease is the leading cause of death globally, then cancer, and then it's followed by diabetes. And what are these three countries doing to prevent and treat? China's partnership with disease prevention programs are addressing public health concerns to improve its ability to prevent, detect, and respond to public health concerns. Canada is working globally to help prevent and/or control chronic illnesses, applying a public and global health and global policy to improve the lives of its people through this partnership. The U.S. collaboration with prevention programs through research, clinical care, and policy to help decrease the risk factors associated with a specific disease. Consequently, Canada seems to be more informative to its people as it continues to provide essential health information to its citizens for better decisions and fair health outcomes. And what are these countries doing to improve the quality measures? The disadvantages of disease burden, high mortality rates, falls on the healthcare system, and the deficiencies of health services to the uninsured and citizens who can't acquire access to care. These countries should understand the importance of coordinating public health and medical care services, which are embedded in an effective health system. They must be integrated socially and implement healthcare policies to improve quality and access to care, as the barriers of care are influenced by the lack of coverage and access. China and the U.S. health outcomes and healthcare systems have its shortcomings as they are fragmented by health challenges that address the uninsured, underinsured, and access to care. Providing quality will require the country to engage its citizens to take ownership of their health and preventative care, treatment, and healthy lifestyles. Is there a need for universal care for all of its citizens? Therefore, all receive the same equal care no matter the disease or illness. Only future legislators can address this issue as this debate is ongoing.